Today I'm talking with Anna Waldron. Anna is an accredited practicing dietitian who works at Jean Hales for Women's Health with women who have PCOS. Today we're going to talk about some of the nutritional and lifestyle aspects of managing PCOS. So Anna, tell us, how important is weight in the management of PCOS?
Weight management is a really important part of managing PCOS, but we also need to focus on other positive benefits that a healthy lifestyle can achieve. For example, women may not see a change in their weight, but actually change body shape and have some fat loss, reduce their risk factors for diabetes and cardiovascular disease, and of course improve PCOS symptoms by making lifestyle changes, even if they haven't seen a change in their weight.
So how much weight does a woman with PCOS need to lose to make a difference to her condition clinically?
Research shows that women who lose 5 to 10% of their body weight, and possibly even less, will have clinical benefits. So for many women this is only a few kilos, and this feels achievable to them. I have seen in my practice people who've been told have been told by their doctors and other health professionals that they may need to lose 20 or 30 kilos, possibly to be in the healthy weight range, and they feel despondent and helpless, and they've tried so many different diets and not been able to achieve this. So I think it's really important to encourage women to make healthy lifestyle changes to achieve just a small amount of weight loss initially, and they then can embrace that and make those changes.
So what's the best diet for women with PCOS? Is it low carb? Is it restricting calories? Is it high protein? What's the approach?
Well, at this stage we don't have a consensus in the literature on the ideal dietary composition. So our priority is encouraging people to eat healthy foods in line with the dietary guidelines and ensuring that they're not overeating, so portion control is a really important part of it too. As we're dealing with a group of women who generally have insulin resistance and are at risk of developing diabetes, we also need to consider carbohydrates. So both the amount of carbohydrate food that people are consuming and also the type of carbohydrate, so the glycemic index of the foods that they're having. So in general, we would encourage people to eat regularly over the day and split the carbohydrate over those meals fairly evenly, and to learn about which foods have a lower GI and try and incorporate some of those into each meal.
So in practice, Anna, how do you approach working with women with PCOS?
I think it's actually really important that we listen to these women with PCOS. Many of them have tried many things before. Some of them are already following a healthy lifestyle and doing really well, and they need to be encouraged to continue to do that and helped by help them alleviate their frustrations. So our approach really is to encourage them to have a healthy lifestyle and to focus much more on what they're eating and their activity levels rather than focusing on their weight. Many have had a long history of dieting and following very restrictive diets. So they've been on the dieting cycle and they've been feeling deprived at times and then overeating in relation to the comfort eating side of things. So I think working with women to understand that they don't need to be restrictive, that they can follow a healthy eating pattern, and to normalise eating is really important.
Are eating disorders common in these women, and what should doctors be on the lookout for?
It is fairly common for women with PCOS to feel quite negatively about themselves and have a poor body image and self-esteem. I think doctors should be aware that many women have had a history of dieting and a focus on food, and this perhaps means that on the spectrum of disordered eating they're moving towards an eating disorder. If you had a concern that your patient had an eating disorder, then you could use the eating attitudes test, which is in the PCOS guidelines, to formally screen them for an eating disorder. And of course, if you identified the patient to have an eating disorder, they would need specialist help and ideally a referral to a team that specialises in managing eating disorders.
So what's the key to approaching lifestyle and PCOS?
I think it's really important that we individualise the advice that we give to women with PCOS, because they are all different and have different needs. We need to help women to set their own goals and make sure that the health professionals aren't setting the goals for them. So encouraging women to think of small changes that they can make to their lifestyle, whether it's a dietary change, a physical activity change, or perhaps both, and making sure that they feel really confident that they can achieve that goal. So a small goal perhaps to start with, and feeling that they can achieve that, and avoiding that cycle where they fail and then feel bad about themselves because they haven't achieved the goal. So I think we really need to make sure that we get that right when we're talking to people with PCOS, and recognising that we don't want to exacerbate any anxiety or depression that they may have, and that that we are dealing with issues that are quite sensitive. And as I've said, many women have been through or have a long history of dieting and have been through discussions about food and weight many times before.
So that nicely brings us on to who should a woman be seeing? A woman with PCOS or a young girl with PCOS? Who makes up the team, or who is the best people for them to be seeing to help them manage the condition?
Well, I definitely think most people would benefit from seeing a dietitian in relation to their PCOS and having some support to make appropriate dietary changes and lifestyle changes. I also think a psychologist is an important person in the team, and again, it may not be necessary for everyone, but I think many people would choose to see a psychologist for a few sessions perhaps, to get some good strategies on how to manage living with PCOS and to be healthy and have a healthy approach to their lifestyle as well.